Hi, I'm Dr. Asimov.
Hi, I'm Dr. Atwal.
And today we're going to be talking about sleep and why it's the foundation to whole body health. We tend to think of sleep as something that happens when we close our eyes, but it's far more involved than that. It involves your brain chemistry, your nervous system, your airway, and even most importantly, your mouth. Bruxism is not necessarily just a dental problem, it's a neurologically driven issue. Grinding is often the symptom, not the cause. Hi, I'm Dr. Asimov.
Hi, I'm Dr. Atwal.
And today we're going to be talking about sleep and why it's the foundation to whole body health. We tend to think of sleep as something that happens when we close our eyes, but it's far more involved than that. It involves your brain chemistry, your nervous system, your airway, and even most importantly, your mouth. As an integrative dentist, I see every day how important it is to have a healthy oral cavity and how sleep is so intertwined to having a healthy body.
The dental sleep connection. So what we look for is patients or people that have a protruded jaw, a narrow palate, grinding, or what we call bruxism in our profession. These are the things we're looking for when we see patients that may have sleep apnea. A lot of times we can have solutions to mild to moderate sleep apnea. What the solutions can be a mandibular advancement device. This device helps open up the jaw and move it forward in order to be able to breathe in better.
I also wanted to add another symptom and sign that we see is chronic dry mouth and bruxism. As Dr. Atwal said, what that means is grinding your teeth. Dry mouth, if you're a mouth breather and your mouth is open when you're sleeping, then you're going to experience dry mouth. And bruxism is not just a dental problem, it's a neurologically driven issue. And so our role as integrative dentists is to make sure that we're protecting the teeth, we are reducing the muscle overload on the TMJ, and we're also looking for other stress and other airway related issues and looking at the patient as a whole. And grinding is often the symptom, but not the cause.
Grinding is often the symptom, not the cause. That's a very important topic.
So nutrition and supplements are a big part of having a good sleep regimen. And I'll tell you a little bit about what I recommend and also what I do at home. So food and nutrients actually really affect sleep more than most patients or people think. And it's really, really important to make sure that you have good sleep hygiene and a good nutrition regimen. So I think what's most important that I'd like to start with is melatonin is all the buzz. And I think it's a great addition to your sleep regimen. It helps regulate your circadian rhythm. I also think tart cherry juice is very good with helping natural melatonin secretion and helping with inflammation as well. Something else, kiwi fruits help with serotonin support. Magnesium, now there's a lot of different types of magnesiums. I personally take magnesium glycinate at night before bed, and I go about 400 to 500 milligrams. Again, you should always consult with your physician before taking anything, but I think magnesium is a very, very important supplement to help with sleep. I also think omega-3s and vitamin D are really good for inflammation reduction and sleep efficiency. I take all of those myself. There's amino acids that also help with this. But I want to stress how important diet is because a fiber-rich Mediterranean diet is really going to help with an anti-inflammatory lifestyle. And the more you keep inflammation at bay, the better you will sleep at night. And again, that goes back to having those nitrate-rich vegetables, which promote, again, reduced inflammation, blood pressure regulation. Nitric oxide in the blood is a vasodilator, and that's why it's so important to get those good green vegetables in your diet. And also making sure that you're paying attention to the timing of how you eat and when you eat. Eating carbs earlier in the day and eating a lighter dinner at night is really going to help keep blood sugar regulation, which is going to help have good sleep at night, because if your blood sugar is going up and down, that's going to affect how you get restful sleep. But if you can keep your blood sugar nice and healthy and keep your blood sugar at bay, that's really going to be important in getting a good night's sleep. Also, talking about when you're eating, how you eat, it's important to eat properly as far as balancing your macros. I always like to go fiber first, protein second, and carbs at the very end. And that really keep your blood sugar at bay as well.
Two major gases that control our sleep: carbon dioxide and nitric oxide. So carbon dioxide has to be in a certain level. In the wintertime, we close our windows and the carbon dioxide increases. So when the carbon dioxide increases, your fight or flight response occurs. And if you're in fight and fight, you cannot sleep as well. So your deep sleep suffers and you don't get the restfulness that you need.
Let's talk about nitric oxide. What does nitric oxide do? It dilates your blood vessels, it improves oxygen delivery, and it supports a calm, rhythmic breathing. How is nitric oxide produced? It's produced via nasal breathing. And that's why it's so important to make sure you're not mouth breathing at night, you're not having excess CO2, and you're getting a restful night's sleep. I want to talk a little bit, I know we talked about this a little bit before in a different episode about mouthwash and nitric oxide. So when you have an antiseptic mouthwash, what that does is it kills off the good bacteria in your mouth, and that can be problematic because then you're not producing as much nitric oxide during the day or in your sleep. So that's why we don't recommend any type of antiseptic mouthwash, because we want to promote nitric oxide production via nasal breathing. Also, foods that support nitric oxide production are greens like arugula, spinach, lettuce, and also colorful vegetables and like beets. Beets are a really good source. So it's really, really important to talk about supporting the microbiome with healthy nitric oxide friendly fruits and vegetables, and also avoiding any type of antiseptic mouthwash to promote a healthy, friendly microbiome.
And what can really help for the CO2 concentration is opening a window and getting that fresh oxygen in.
That's a big thing, as far as we want to make sure that the simplest sleep upgrade is cracking a window at night, making sure you use blankets instead of sealing the room, like closing all the windows, closing all the doors. That's just going to cause a buildup of CO2 in the room. And again, it's going to affect your sleep quality. So best thing, crack a window at nighttime, aim for controlled levels of CO2. We always recommend, and this might be a little bit extensive, a little less than 1,000 parts per million, but that's pretty hard to measure on a regular basis. So just cracking a window is really the simplest way to do that.
And also have a supportive nitric oxide diet. Mm-hmm. And even sometimes using a nasal strip on your nose can help breathe through your nose.
Yeah. We talked about mouth breathing several different times, but I just want to touch on that one more time. Mouth breathing, really essentially what it does is it puts your body in a fight or flight state, right? If you're not breathing, so when you breathe through your nose, you're in a parasympathetic state. But as soon as you start mouth breathing, you activate your nervous system. And if you're mouth breathing throughout the entire night, that's going to elevate your heart rate, and it's going to constrict your blood vessels, and it's not going to allow your body to go into full restful sleep.
And it's going to dry out your mouth, and it's going to cause inflammation in your mouth, and it's going to cause a higher bacteria saturation in your mouth. So mouth breathing is just not a good situation.
So again, we want to support nitric oxide production through nasal breathing. We want to avoid mouth breathing. So we recommend, let's go through what we recommend again to upgrade your sleep. Okay, so what you can do at night before you go to bed, besides following the diet and supplement regimen that we recommended, is cracking the window open at night, not sealing your room, not sealing the windows and the doors shut.
Breathing through your nose.
Breathing through your nose. Support a nitric oxide diet with arugula, beets, lettuce, spinach, things like that.
And you're probably asking yourself, well, if I mouth breathe, how can I not mouth breathe? Well, there's also mouth tape. Mm-hmm. So it's important to know that there is mouth tape in the market that can help seal your lips, which is a lot easier than you think it's going to be.
So sleep is not just about pills and trackers. It's really about a complex blend of your nervous system, your airway, nutrition, and your oral health. And we want to tie all of these into whole body wellness. And it's really important to make sure sleep stops becoming a struggle and it becomes something to look forward to again.
Well, thanks for tuning in, and we will see you next time.
Thank you for tuning in, and we look forward to seeing you at next week's episode. Thanks again.